Health screenings, nutrition counseling, chronic disease management, these are just a few of the free services you'll find at VCU's Health Hub at 25th in Richmond, Virginia. Let's talk today to Cheryl Garland, the Chief of Health Impact for the VCU Health System. This is Healthy with VCU Health. I'm Aileen Ellis. Cheryl, tell us why you chose this location for the Health Hub at 25th.
Well, we chose this location because it is in a community that has historically had some challenges. When we look at the city of Richmond and the demographics, what we know is that this is a community, the East End, that is, of Richmond, is a community where 4 of the city's 6 public housing developments are located. It's also a community that has historically been rich in its assets, in its community engagement, but over time, there have been changes that have occurred with the closing of businesses. The East End of Richmond happens to include census tracts that are food deserts. It is a community that has gone through multiple changes over the years, and throughout the work of many of the faculty and team members at VCU and the VCU Health System, we've received feedback from the community about the need for services and programs to address some of the needs that exist. And so when the new market at 25th was in the planning stages, an opportunity arose for our teams to come to the table to look at how could we bring resources and assets from the university and health system to address some of the unmet needs.
So when you say new market, that means a grocery store right around the corner or right close to the health hub?
That's correct. The market at 25th is the newest grocery store in the East End of Richmond, and our health hub is located adjacent to the market, and it's also in the same development where Reynolds Community College will be opening its new culinary arts program.
What do we know about low-income communities and why they in particular are so vulnerable?
Well, what we know about low-income communities is that individuals who live in those communities are facing issues that impact their health outcomes, impact their education, impact their overall health and well-being. And many of these are called social determinants. There's truly a body of evidence that links economic and social disadvantage with avoidable illness, disability, suffering, and even premature death. There's a body of work that's been done by the University of Wisconsin through its county health rankings model that actually has demonstrated that 50% of health outcomes, that is how long people live, their quality of life, are impacted by factors that are related to these social determinants. And social determinants are essentially the conditions in which people are born, grow, live, work, and age, including access to health insurance and coverage. And so examples of social determinants might be whether somebody is employed, whether or not they live in poverty. Are they faced with food insecurities? Do they live in safe neighborhoods, have access to transportation, or even have health literacy issues, which are often driven by their level of education?
So an example of this might be that the rates of heart disease would be higher or diabetes in a community that's low income?
Yes, that is correct. And there are studies that have actually been done by our own local health department that look at where are the highest incidence of poverty in our communities, and then overlaid the mapping of where it is that we see high concentrations of poverty by census tract with where is it that we're seeing the highest incidence of diseases such as diabetes or hypertension or heart disease. And unfortunately, what we're finding is that in many of the communities where we have the highest poverty rates, we are also seeing the highest incidence of these chronic conditions.
So, meeting the needs of people in their own communities is probably more successful, I would assume, than having them go across town to see a doctor or get more education.
Yes, I think that's a fair comment because one of the things that we know is that addressing an individual's conditions in their community, in their home, has a huge impact on their overall well being and their health outcomes versus if the only interactions that our healthcare system and providers are having with individuals is when they are in our clinical environments, when they're in our hospitals, in our emergency departments, then we're missing a huge component of what it is that may be driving the conditions that individuals are faced with.
The Health Hub sounds like a place where people can connect with their neighbors and encourage each other and develop new healthy habits together. Tell us what it's like to be in that space.
So the Health Hub is a creative space that does a few things. The first is it brings together assets across VCU and VCU Health System to really focus on the issues that have been identified by community members, either through focus groups or conversations or surveys, and looking at data that basically shows us what some of the issues are. And so our goals are to really focus on improving health and wellness through the delivery of preventive and supportive services. The Health Hub gives us an opportunity to bring together our faculty from VCU, our students, our team members, with community members around focused programs and initiatives that directly address their concerns. We have consultation spaces where there's an opportunity to have one-on-one conversations with community members and or their family members. And we also have large educational spaces where we can bring together groups who are working together to address issues, to work on fitness activities, to learn about what some of the drivers are behind chronic conditions or issues that community residents are dealing with.
But it also sounds like a fun place in the sense that when neighbors can encourage each other in an exercise class, for example, that there's time for that?
Yes, there is. And so we've partnered with Sports Backers and their Fitness Warriors program to host sessions for that group. And that has been very exciting, very well received by community members because the trainers are often individuals who live within communities who have learned the skills of leading fitness classes.
What about the health screenings that are free? How does one participate in that?
We have partnered with a couple of the schools to implement the screenings. So one particular program that is functioning at the Health Hub is being managed by the Richmond Health and Wellness Program. And this is a program that is interdisciplinary in nature in that it brings together representatives from a host of schools, including our School of Nursing, pharmacy. We have folks from our Department of Psychology as well as our College of Health Professions, which brings occupational therapists into the group. And the goal is to build off of a program that has historically worked with seniors in congregate living facilities, primarily senior high-rises throughout the city, and provide coordination services to help seniors age in place longer. What we understand is that not all seniors live in congregate facilities, that we continue to have seniors who may live with their family members in single housing or live by themselves. And so we've taken this Richmond Health and Wellness Program model and we've now introduced it into the Health Hub, where a couple of days a week we bring in team members from the Richmond Health and Wellness Program from these various schools and programs who are available for not only seniors, but anyone in the community who might need some help in getting a better understanding of what's going on with their health condition, connecting with their primary care provider, identifying other resources that might be helpful so that they can continue to manage whatever condition they have.
And everything that you would receive from the Health Hub is free.
That's correct. We are not charging for services. And again, part of it is because we are leveraging the resources and the assets that we have in our university and our health system. But the other is that there are healthcare services that exist throughout the community that we do not need to duplicate. The goal for the Health Hub is to provide programs and initiatives that complement and often fill in gaps related to how people navigate to those resources and services. And so we'd like to make sure that it's understood that we are there to create partnerships and to make sure that the residents in the East End have an opportunity to learn about what resources might be available that they haven't tapped into, and we have the assets that can help them to do that.
And someone to help follow up with them and encourage them as they move along that journey.
That's correct. And in fact, one of the things that we've done is partnered with the Richmond City Health District and introduced a community health worker into the Health Hub. And her job is to help individuals navigate to the resources that are available in the community and across the city. So it might be that they are in need of something that we don't even offer at the Health Hub, but the community health worker is there to help people navigate to those services.
Is there anything else you'd like to add, Cheryl?
This is an innovative initiative that allows VCU and VCU Health System to really transform the way that we are engaging our students, the way that we are working with the community that we have served for so many years. And our hope is to build new relationships and trusted relationships with community residents so that we are able to bring many of the services and resources into a community that has expressed the need for filling in some gaps and addressing some issues that are impacting the health and the life of so many individuals.
Cheryl Garland is the Chief of Health Impact for the VCU Health System. For more information on the Health Hub at 25th, please visit vcuhealth.org. Thank you for joining us for this episode of Healthy with VCU Health. I'm Aileen Ellis. To listen to this podcast again and check out our other episodes, please visit vcuhealth.org/podcast.